Ever experienced pain in the knees that causes them to buckle? My name is Faris Solomon. I got my degree in the study of human movement, and here's how to identify and fix the cause of knee pain. Let's go. Now, experiencing pain in the knees can be caused by many issues. It can be the ankles, the ligaments, or weakness in the muscles around the joint. Unfortunately, another common cause of knee pain that tends to be overlooked is weakness in the hip muscles, specifically the hip abductors. So, how do you know if they're the cause of knee pain? Well, here are two ways to find out. The first test is a simple squat test, and we're going to be paying attention to our knees to assess if they're buckling inwards or if they remain straight forward. So doing a simple squat, if we notice our knees bending inwards while we're squatting, that will imply weakness in the hip abductors. The second test is called the Trendelenburg test, and that's a simple one. We're going to keep our feet close together, place our hands on our hips, and simply lift one leg. Now what we're looking for is to maintain almost a straight line in the hips without excessive leaning to any direction. So for example, if the hips sway to one side of the lifted leg, or I'm trying to counteract the balance by swaying too much on the other side, then that would imply weakness in the hip abductors. But if a straight line is maintained, then that would apply strong and stable hip abductors. Moving on, I have 4 strengthening exercises that will be ordered from least to most challenging. For the first exercise, we'll be doing hip abduction while lying on our side. So I'm gonna lie down, try to get comfy. Now I'm gonna keep my toes facing forward, going up, trying to focus on activating the hip abductors, while also paying attention for my hip not to bend too much forwards or backwards. Just trying to keep it midline. And we're gonna go for 20 reps. For the second exercise, we'll be doing the exact same movement, side lying hip abduction, but we'll be using a resistance band to make it more challenging. So I'm gonna go and lie down on my side. The exact same idea, not bending too much forwards or backwards with the hips, toes facing forward. Now we're gonna go to 15 or 20 reps. Now to turn it up a notch, we're gonna be doing hip abduction again, but while maintaining a side plank. So rather than resting down, I'm gonna maintain a side plank position, and now I'm gonna start the hip abduction. Then we're gonna feel both hips working this time. And we're gonna go for 10 to 15 reps. For the last exercise, we'll be doing crab walks, which is done with a resistance band. I'm gonna go into a partial squat, choose a direction, take one large step followed by half a step. Now going back where I came from, large step, half a step. And depending on the space you got, you can keep going for around 5 to 10 cycles. Adding these exercises to your routine will help deal with knee pain, as it conditions the muscles that influence the knee joint, emphasizing both flexibility and strength to stabilize the joint and avoid abnormal muscle actions. Stay active and mindful.